So this is presentation number 4, which is a workshop on Alzheimer's and dementia with Jaime Cruz, who is a social service worker with a specialization in gerontology. She is the public education coordinator for the Alzheimer Society of York Region, and we are so happy to have her here today.
I'm very excited to do my presentation for you today. Maha, thank you so much. And Unionville Community Service to invite me to present today. I'm going to share my screen with everybody. Okay, is everybody able to see this okay?
Looks great.
Wonderful. Okay, so today I'm going to talk about Alzheimer's disease, brain health, and finding your way. So what I really want to start off with is some numbers that really resonate, because we always get numbers in that are associated with the states, but this is all Canadian, so it will really feel more impactful knowing that these are Canadian stats. So what you should be aware of is that there are over 500,000 Canadians who are living with Alzheimer's disease and a related dementia. By the year 2030, that's not that far off. There are going to be over 912,000 individuals. And of those Canadians that are diagnosed, there are about 65% of them that are under the age of 65. Under the age of 65, my goodness, that is so young. 65 is now the new 25. I'm not even quite sure where that middle age line is anymore. And 1 in 5 Canadians, 1 in 5, which isn't very large, has experienced being a caregiver, a care partner, or caring for somebody who is living, with Alzheimer's disease or any form of dementia. Now, one thing that I also am really trying to do is stop the stigma that is associated with any form of dementia, because there still is that relation where people hear Alzheimer's disease, and it is very frightening. And there still is a stigma that is associated with hearing that word, dementia, Alzheimer's, any of those. And 56% of Canadians are really concerned about how others are really going to be responding when they hear that somebody that they know is living with Alzheimer's disease or related dementia. 46% of them are embarrassed, and they're also ashamed that if they did have Alzheimer's disease or related dementia, how are other people going to respond to them? And 87%, which I really believe that this number is way too low, but 87% of caregivers really wish that others could just walk in their shoes for one day to really understand what it means to be a caregiver for somebody who is living with any diagnosed dementia. By the year 2050, again, we're in 2022, it's not too far. We're going to have a worldwide estimation of 50 million individuals living with Alzheimer's disease and related dementia. Every 3 seconds, somebody's been diagnosed. So I've been speaking for about maybe 5 minutes or so. So within that 5 minutes, every 3 seconds, okay, math, not my strong suit, but we can imagine how many people every 3 seconds within that 5 minutes, there is a new person that is being diagnosed. Now, there are more women who are actually diagnosed with Alzheimer's disease than men. And we're going to talk a little bit more about that in just a few more minutes. But men are at a higher risk of developing vascular dementia. And I often get questions, well, what's the life expectancy and how long can somebody live with Alzheimer's disease? Well, the truth is that it's very hard to determine what the life expectancy is because people have so many other underlying conditions that can contribute to what can either have somebody's life expectancy go longer, or they could actually pass away sooner, depending on how they actually live, what their quality of life is like. So the average person can live 20 to 25 years with Alzheimer's disease. And that's including the 7 years of approximately somebody who is living with Alzheimer's disease and hasn't even been diagnosed. One thing that we do know is that exercise is one of the most important things that we can do to help reduce the risk of Alzheimer's. So here's a few fun facts for us. So back in the 1800s, this lovely couple here, I don't know, they had some nice photography, but their physicians weren't very good on how we could take care of ourselves. Nobody lived to be 100 years old. It was unheard of. Nobody could live that long. Then we move to about the 1900s, and approximately 3 people in the 1900s, the early 1900s, people were living to be 100 years old. And then we jump to the year 2007. Now, this is my kind of group. I love this group. They look like they're having fun. They're at the beach. They're having a great time. And look at how the number has just escalated to over 7,000 individuals who are living to be 100 years old. That's a huge jump. And then we look at our distinguished Kirk Douglas, who lived to be 103 years old. Even at 103 years old, my goodness, he's a very handsome fella. So I talked about in the year 2050, how many people do you think will be living until 100 years old? And I see there's approximately 47 people on the call. And maybe if you want to just put a quick number in the chat or unmute yourself, because I'm curious to see where you think individuals will be by the year 2050 and how many people will live to be 100. So you can unmute or you can put it in the chat. 100,000? That's one guess. Anybody else? 2,500? Or 25,000?
I will guess about 50 to 60,000.
50 to 60,000? Any other guesses? Well, by that time, we are looking at about 80,000. So everybody pretty much guessed pretty close in the middle. By the year 2050, there's going to be over 80,000 individuals who are going to be living past 100 years old. And if I look at anywhere as good as Kirk Douglas here, count me in, I'm there. So why are we talking about the brain? Our brain is a very complex thing, but what we need to recognize is it's a computer. So you see the picture, it's got all these wires because it's the computer that is controlling all aspects of our brain. It makes us move our arms up and down. So my brain is telling me that I need to look silly and I'm going to hit my arms up and down. It's giving me the opportunity to communicate. What am I going to say? What language am I going to speak? How am I going to sequence my words? My brain is going to say, I need to feel safe. What do I need to do to keep safe? Do I need to run across the street? Do I need to eat something that's expired? How am I going to dress? Should I be going out after a certain time and going into certain areas? My brain is giving me that signal on what I should and shouldn't do, but it's also controlling my judgment and my reasoning. Now, yesterday was a lovely sunny day, and maybe I could have worn just a sweater, a heavy sweater, and I would have been okay. But if I looked outside and I thought it might be like a summer day, I might perceive it to be a summer day and I might not dress appropriately. Well, if yesterday was a sunny day, then today's got to be summer too. So I'm not going to judge the fact that now my kids are home today because there's a little bit of freezing rain and I can still dress for the summer because there's freezing rain. But there was sunshine yesterday. So it's giving me also the opportunity to be able to reason with what I should do, what I shouldn't do. You ever get that feeling in your stomach of butterflies where it's like some people before they perform or they do public speaking and they just don't feel 100% right. And you got the devil on one side and the angel on the other. And I tell my kids, Mummy angel is here and Mummy devil is here. So you always need to listen to Mummy angel, and I'm going to give you the right reasoning to whatever judgment that you're trying to contemplate. And it's telling us what we're doing. Well, we're here on a Wednesday afternoon, and we have Maha, who has put this whole day together with these fantastic presentations for everybody. So our brain is telling us that we're here to learn. And it's telling us why we're doing it. Why? Because we need to exercise our brains. We as humans need to absorb information and we need to learn because our brain is only the size of your two hands put together. And when you look at your 3-pound miracle, that's the size of your two hands. It's controlling everything about what you do and what you say. So this is just a little map, like a treasure map of your brain to show you where everything is on the lobes of your brain, where your emotions are on your brain, where your vision is controlled from the back of your brain. My balance. It's important to recognize because a lot of people, if they have a fall and they hit the back of your head, that's your balance. So when doctors assess you, they're going to look at the back of your brain because you might have a concussion. If you have a concussion, it will absolutely affect your balance. It will affect your speech as well. And everything kind of intertwines. And you see how my vision is at the back of my brain, but it's got to go through all my skills, my sensations, my balance to get to the front of my head. And I'm going to perceive it at my eyes. And I'm going to give you an example in a minute. So here we go. So when you look at this picture, this is what you're perceiving. Your brain is seeing one thing, and it's giving you the sense of what you think that you might see, but it's not always what you first see. So when you look at this, what are you seeing? And you can call out, what do you see when you look at this image?
People facing each other, 4 people?
Yeah,
5.
people facing each other?
Yeah. Vases.
Vases?
Or
I don't know if we have any chess players, but they look like chess pieces to me.
Yes. So those are 3 great answers. And now that people have actually said a vase, chess pieces, people facing each other, it's now easier to maybe see one rather than the other, to cancel out the chess pieces, because now I'm really focusing on the people, or I'm only focusing on the vase, because it's what your eyes are perceiving that is coming from how your brain is interpreting that actual picture. And it's what you see through your eyes that is traveling all the way back to the back of your brain on what you see, but it's based on your perception. So your brain needs to work together with what you see. All your lobes need to work together. Now, here is another picture, and this one gets me a little bit crazy because I look at it for way too long. But it gives you another idea on how your brain and your eyes are working together. You're trying to find clues. You're looking at the different shading of the elephant and how many feet does an elephant really have? And where exactly are the feet? And is that the trunk or is that the foot? Because I'm really not sure what I'm seeing. But this is another indication of how your brain is talking to your eyes to perceive and to figure out, what is that? Is that a foot or is that the trunk? So I'm going to change this picture because the more I look at it, the more dizzy I get. But it's a great indication for you to look at to see how you perceive one thing, and your eyes and your brain are changing things every time you look at something. So here we go, the $1 million question. What is dementia? First off, it is not a normal part of aging. It is common, but is absolutely not a normal part of aging. It's not like as we get older, and Carrie mentioned in the last presentation about maybe our eyesight deteriorating. Cataract has become more common as we age, or there's some other things. Our hearing starts to change as we start to age. Dementia is not a normal part of aging. Dementia itself is actually a medical term to describe a series of symptoms that coincide with a diagnosed dementia. And these are just a few of the symptoms that individuals experience. So we all know and we all hear that memory loss is the first thing that people start to recognize as one of the symptoms. Short-term memory especially. Why is my short-term memory deteriorating so much quicker? So here's our brain, our 3-pound brain. And we're going to open up our brain here. And your hippocampus that's inside your brain, that's responsible for retaining and maintaining short-term memories and long-term memories. So why can I remember something that I did 50, 60 years ago, and I can't remember what I did this morning? Well, what I did 50, 60 years ago has been glued into the back of the hippocampus of my brain for so many years. But now the things that I'm doing, what I had for breakfast, and over time, all the memories just keep piling on top of each other over and over and over. But once I start to have difficulties with my memory and I start to forget things, my short-term memories, it's like paper falling off. What did I have for breakfast? I don't know. What did I do yesterday? And all those short-term memories start to fall out until we get to closer to long-term memories. Eventually, there are some long-term memories that do start to deteriorate. I mentioned about judgment and reasoning. Now, we should make sure that our medicine cabinets are completely cleared of any kind of expired medications. Because if I have a headache with this crazy weather today, if I feel like I need a headache and I go to the medicine cabinet and I'm like, oh, this Tylenol, it expired in the year 2000. Oh, that's okay. I'm just going to take 5 or 6 of them and it will be okay. No, my judgment and reasoning is completely not correct. You do not take more because it has actually expired. You could do a lot more damage to yourself if you increase the dosage. Throw the bottle out and just go to the drugstore and buy a new bottle. So my judgment and my reasoning has been affected where it's like, I'm just going to take it anyways, because that medication, that Tylenol, it might actually affect some of your other medication that you might be on. Or if I open up my fridge and I go, oh, wow, look at that lovely cheese. It's so pretty and blue. I think I'm going to eat it. No, don't eat it. It's moldy. Throw it out. Somebody who's not affected with their judgment and their reasoning will recognize, that needs to go in the garbage. It doesn't look so good. And I don't think I should be consuming that. So it's that safety component. What you should do to keep yourself safe and to keep other people safe. Communication. Often individuals are so lucky that they're able to speak multiple languages. What happens when individuals start to progress with a Alzheimer's disease and a related dementia is they start to go back to their mother tongue. And what starts to happen is we've got English and you've got your mother tongue language, but it's a different dialect. And often the words and the sequencing of the words aren't coinciding, and it's more like a word salad, and I'm mixing up the words, and I'm not able to use the words to describe certain objects like pen. I might have a different word and hear the pass me the thing, the thing. And this is where we see a lot of charades, and people will start to, the thing. I'm like, oh, the pen. So you get really creative with different charades. And my husband always says, thing. And I say, if you say thing one more time, I'm going to hit you with the thing. So let's use our words. You want the pen? Ask for the pen. The more we use your words and we articulate and we use those strengths, the better you're going to be able to hold on to it. And that's what we want to maintain. Your ability to function on a day-to-day basis, to get up, get dressed, your personal care, maybe you like a cup of coffee, cup of tea, cereal, the things you do on a day-to-day basis. But when you're starting to have difficulties with your day-to-day functions from the moment you wake up, and I don't know where the washroom is, and I don't know what I need to do, and I pick up my toothbrush, and I recognize that the toilet needs a scrubbing. And maybe this is what I need to do. And I need to scrub the toilet. So make sure, first of all, you hide all the toothbrushes and you don't have that at access. Moods and behaviors, absolutely, it's going to change because I'm recognizing that I am no longer able to do things the way that I was once able to do. So I am going to be angry, emotional, frustrated. I am going to lash out at people. I am going to be bitter. I'm going to isolate myself. I'm going to become depressed. There are a whole bunch of emotions and moods that you're going to see in somebody, because if you're going to tell me that I'm no longer able to go down the street for a walk and get the mail by myself, well, I'm going to start yelling at you because I've been walking down the street by myself for so many years to get the mail. And what? Now I'm not allowed to because you're saying it's not safe? Well, you're going to see a lot of behaviors that are going to come out of me. So we use the dementia as an umbrella term because each spoke represents a different kind of dementia that is diagnosed. These are the 5 most common diagnosed dementias. So we have Alzheimer's disease that affects 65% of individuals, frontal temporal dementia, which is individuals who are not necessarily affected by their memory first, but it's their behavior. So it's oftentimes people might think, oh, it's a midlife crisis. But no, it's individuals' behavior that is affecting the frontal part of your brain. And it's oftentimes, I see it, I want it, I'm taking it because it's mine. Those are my headphones, Maha. I'm coming and I'm going to take them and I'm not going to ask because I don't need to ask for something that's mine. So just step back and give me my headphones. Lewy body dementia has a correlation with Parkinsonian traits. So a lot of the same rigidness, the stiffness, there's a speech difficulties because this is affecting our muscles because we're not able to also control the muscles in our mouth. So our words are not crisp and they come out slurred. So the articulation of our words start to deteriorate as well as our body functions. So our body starts to fail us quicker than our memory. But I have great news out of all 5 of these. Vascular dementia is the one dementia that we know that we can prevent. Does anybody know why that might be? And you can unmute yourself and answer that.
Keeping your cholesterol level
Cholesterol level, thank you, that's great, yes. So we're going to continue with that answer. Cholesterol. Cholesterol relates to how we take care of ourselves. It's our lifestyle. So vascular dementia is from a series of strokes, from heart attacks, from a lack of oxygen. It's from what kinds of foods we consume. It's our exercise. There's so much that we can do in our life to prevent a vascular dementia. And that's why I say it's the one dementia that we can prevent, because it's how we take care of ourselves. And we know that cholesterol is from maybe diet. It could be genetics, which is very common. I have high cholesterol. Thank you to my father who gave me high cholesterol. And I don't eat any of the foods that he ate, but thank you. So I take medication for that. But I can maybe reverse it by my lifestyle, and I am a vegetarian, but I'm still have high cholesterol. But then there's this mixed dementia, where oftentimes individuals are living with vascular dementia, and over a period of time, they've been living with vascular for so long that they start developing Alzheimer's symptoms, or they have Lewy body dementia, and maybe they've had a series of TIAs, which are a series of small mini strokes, which could result in a mixed dementia. And it could be with anything. So what I'm showing you here are, it's raining different diagnoses, and some of them you may be familiar with, and some of them you may not. So there are over 100 different diagnoses, and we're trying to learn about them as much as we can. And why are these all considered to be a dementia is because they are a progressive neurological disease with no cure. Are there warning signs? Of course there's warning signs. There's warning signs for everything. So oftentimes the first thing is memory loss. And in the early part of a dementia, oftentimes families just brush it under the carpet and go, oh, Mom didn't mean to put the bread inside the dishwasher. She was probably just so busy putting the groceries away and trying to make sure that everything was all taken care of, and she got flustered. But then you talk to the doctor and you realize a couple years have passed and you're like, oh, that makes sense now. Okay. Or mom's not able to make a cup of coffee. Now, I know I have a Keurig machine, so for me, it's relatively easy to take the pot and put it in and push down. So, but I'm not able to make that coffee anymore. I've been making coffee for as long as I can remember, but I can't do it anymore. So I'm peeling back something and I'm pouring it into a cup. So the tasks that I was able to do, I'm no longer able to complete anymore. I talked about the language difficulties, the ability to speak. This is where we also see a lot of paranoia and suspicion, because Maha's talking about me. I know it. I see her over there and she's talking. I can't hear her, but she's talking about me, and I'm really paranoid because I can't follow the sequence of what she's saying. So I automatically bring it back to myself, and I'm paranoid and suspicious. She's laughing at me. That's what it is. They're all laughing at me. And that's going to change my behavior. And I'm getting disoriented with the time, and I'm not sure, especially with this time change that we just experienced, that really throws a lot of people for a loop, including myself, because I never changed the clock the night before and I wait until the next day. So that completely throws a lot of people off with the time change. But this is where often people say, I want to go home. I want to go home. Well, I live in Vaughan, but I wasn't born in Vaughan. So I was born in Toronto. So when I'm saying I want to go home, it might not be Vaughan, where I've been living for 20 years. It could be, I want to go home to where I grew up, to where I was born. I was born in Toronto. I was born in Italy. I was born in any other country. Difficulties with judgment and decision making. Again, we talked about this, about safety decision making, what I should wear according to the weather, abstract thoughts, money, 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 money. And often families don't even recognize that this is a problem until maybe they get a phone call and they say, hello, Miss Cruz, your mother hasn't paid her property taxes for 6 months. And I'm like, oh crap, she's gonna have to live on my couch because I can't afford her 6 months of it. And the bank is taking the house. And I'm getting the phone call saying, CRA, you owe us money. How many times have we gotten those phone calls? My mother gets those phone calls and she's been caught. Her computer's been compromised because she paid money, and they're so convincing. And somebody who is living with a dementia, which my mother doesn't live with a dementia, but they are very convincing. It's about, how am I going through my day-to-day routine? If somebody is coming to the door and saying, hi, I'm from the Girl Scouts, would you like to buy some cookies? No, thank you. People don't go door to door. I'm misplacing things all the time. I misplace my phone all the time, and I tell my kids, call my phone and tell me where it is. I misplace my keys. Where do you think people hide their belongings the most popular place? And you can again unmute yourself and let me know where you think. Anybody have an idea where people might hide things?
Maybe under the pillow.
Under the pillow? That's very
behind
good.
the clothes.
Behind books? Are you ready to hear where people hide things?
In the fridge?
In the fridge is another common one, but this one's a little kind of gross. Okay, ready?
Clothes.
Behind clothes. We just hope it's not in the dirty hamper. But this one People hide things in the toilet tank because who's going to look in there? Now, many individuals, and obviously the generations are changing, they needed to hide things to keep things away from people because their homes were getting ransacked or because things were being stolen. So people often would put things in places that they never thought that they would actually look. So it would end up in the toilet, in the back of the toilet tank. So I said, and I do a presentation for the psychology class for Seneca College. And I asked this question and he goes, but you're supposed to put your drugs in the toilet tank. And I'm like, whoa, I don't think you should tell anybody this. But now we know, and it's now on record where you put your belongings. But to put it in a mattress, to put it in a fridge, to put it in your underwear drawer, it is common to hide things because it's mine and I don't want you to find it. I talked about behaviors already. Personality coincides with that. Sometimes people turn into Dr. Jekyll and Mr. Hyde, and sometimes they become Mr. Rogers. And one caregiver said to me, oh my goodness, I wish that my husband developed Alzheimer's disease years ago because he's now Mr. Rogers and he's so much nicer to live with. So personalities can change because of the diagnosis, because of the change of the brain. And initiating activities, it's not that somebody doesn't want to partake in a activity. It's also because they're afraid that if they try and they do an activity, or I say, Maha, do you mind taking care of dinner while I go run to the grocery store and I go to Walmart and I go pick up a couple of things? Well, I've stumped her now and she doesn't know what to do. So instead of doing anything and getting dinner prepared, she's not going to do anything. And that's going to look like depression to the family, that she's not able to, that her capabilities are deteriorating, that she is also embarrassed to fail. Because families often have a very high expectation of what their parents, their spouses, whomever they are caring for are able to do. But as the dementia progresses, it is harder for somebody to do something, but our expectation is still way up here when we need to lower it. So there are things that are beyond our control. One of them is age. Why is age one of the risk factors of developing Alzheimer's disease? Does anybody know?
The brain cells meeting.
We're living longer. In today's day and age, we are learning how to live longer. Fantastic. I can live to be 103 like Kirk Douglas. But the problem is I've also increased my chances of developing Alzheimer's disease. It's not a guarantee. My grandmother lived to be 98 years old and was sharp as a tack and had no cognitive impairment. I called her every week, and every week she kept asking me, so how much is your mortgage down this week? I'm like, well, it's still there, so you can pay it if you want. And she lived to be 98 years old and not one cognitive impairment at all. Gender. Now we're going to think back. Who is more likely to develop Alzheimer's disease, men or women?
Women.
Very good. Women. Women are more likely to develop Alzheimer's disease. Now here's the $1 million question. And if you get it right, you win a big prize of absolutely nothing. Why do women have a higher rate of developing Alzheimer's disease than men?
They live longer.
Absolutely. Okay, whoever is answering, you're on my team, and we're going to go tour around York Region, and you're my new presenter with me. You're absolutely right. Women live longer. Men are at higher risk of a vascular dementia. My husband would still be eating rice and bacon out of a pot like he was before we got married. Men usually don't take care of themselves the way women do. And I know that I'm taking care of way too many things more than my husband. He knows it, and that's okay. But women in general have that instinct where they are just taking care of everything all the time. I get a lot of questions about genetics. My mother had it, my father, my grandmother. The reality is that there is the slightest chance that you could have inherited a certain gene, depending on what kind of Alzheimer's disease or any of the 100+ dementias that have been diagnosed with. But on a whole, you only have a 5 to 7% increased chance of developing Alzheimer's disease more than anybody else. So we all have age-related forgetfulness, forgetting people, forgetting faces, forgetting names of people. Does anybody know who this is? Her real name, though.
Linda Carter.
Excellent, Linda Carter. But there's times when we forget where people are. We might recognize their face. We might kind of have that, I think I know them. But if your children or your grandchildren or your sister come up to you and you don't recognize them, that's more reason to be concerned. Remembering the date and the time. Does anybody know the date today? Is it December 25th?
23rd, March 23rd.
It is March 23rd. It is not Christmas, even though it might snow, but many people don't recognize what the date is because a lot of people are retired. So unless you have an appointment or unless you have received emails about the presentations today with this fantastic lineup, then you're not going to remember it all. Forgetting details about an event and if you've been there and not knowing that you've been to the wedding to celebrate your son's wedding. Now, we talked about forgetting items. This is going to be my car one day. I'm still trying my cherry red convertible Mercedes 500 SL with white leather interior. Thank you very much. Got that down packed and I've been asking for it for Christmas for years and I still don't have it. Have you ever gone to the mall and you don't know where you put your car? All the time. And I always tell my kids, remember where we parked the car. Have you ever gone to the mall and hopped on the bus or called for an Uber or the taxi or called a family member? If you've gone somewhere and you've completely forgotten that you've had a car, especially a beautiful car like this, then those are reasons to be concerned. Not knowing where you park your car up and down the aisles, it's very common. Just have that one area of the mall or the store that you usually park at, and you go down 1 or 2 aisles because everybody drives a black, a white, and a silver car, and they're all the monster sized cars, including myself. So it's very difficult to find your car. Now, I want to warn you, I'm going to show you an image of what a real brain looks like, because I want you to see the difference between what our brains look like and what a brain of somebody who is living with Alzheimer's disease. So if you feel it's too squeamish for you, close your eyes or look away and I'll let you know when it's done. So I'm going to put the slide up. This is a picture of a healthy brain. We want our brains to be big, fat, juicy, just the way you see it. This is the perfect brain. I am now going to show you the brain of somebody who was living with Alzheimer's disease and passed away. So you can see the difference in how there's so many spaces and how it shrunk. It actually looks like a walnut. So somebody is not doing something just because, just to be annoying. That part of their brain has physically disappeared and they are no longer able to respond, to react the way they once were. Their behavior, their language has all changed because of the change in their brain. So I've taken away the slide of the brains if anybody looked away. So we can't change our age, our gender, or our genetic factor. We are who we are. But what we can do is we can change our lifestyle, and this will help reduce the risk of dementia. And it's important that we need to exercise our brains and our bodies. See, it's like the body and the brain of Arnold Schwarzenegger. And these are just some strategies. You can focus your attention and say things out loud. You don't have to always multitask. I write things down. I have notebooks and I'm constantly taking notes. So write things down so you know what you need to do. Put things in places where you always would, like your keys get hung on the keychain when you come in through the door. Maybe put things in clear bins so it's easy for you to see it. So use technology as reminders for alarms, for things that you can help you function on a day-to-day. Group things together. If you need to take your pills in the morning, put your toothbrush and your pills together, or have your pills when you are going to sit down. It's okay to repeat things, because the more we repeat things, the easier it is to remember. And it's okay if you make a mistake. We all make mistakes. We are not perfect. So you are going to make a mistake. The best thing that you can do is exercise. The best exercise is dancing. So I took this clip out of the movie Scent of a Woman, and they're doing the tango. The dancing of today, the way the kids dance, that's not dancing. That's just bopping your head around. But real dancing, like the tango, the foxtrot, the waltz, those take technique. Those take learning the steps, and that is a full continuum exercise that works every part of your body. You're being social, you're working your mind, you're working your body, and it is fun. And it is important to have fun. So for those of you who don't dance like me, because I have 2 left feet, there are always other things that you can do to actually exercise. You can go swimming, because, you know, we all look like Esther Williams going swimming with makeup and hair done so pretty. But swimming is a great exercise because it allows you, especially if you have joint problems, that it is easier on your body to do aquafit, or chair exercise, or go for a walk, or actually just if you enjoy some yoga. Maintaining a healthy diet. Follow the Canadian Food Guide. It's important to have your purple foods because they're high in antioxidants. Get your proteins. You can have chocolate, dark chocolate. The higher the percentage, the better. Having fish is really important. It's high in omega. Now, here's the real exciting part. You can have red wine, but make sure it's okay with your doctor first. Why can you have red wine? Because it's actually made with red grapes, the purple grapes. The purple grapes are high in antioxidants. But still, make sure it's okay with your doctor, because you don't want to be mixing alcohol and your medications. This is one of the newest, and I don't like the word diet, so I'm going to change it to lifestyle. but I have to say diet because I didn't create this. But this mind diet lifestyle is a way for individuals to control blood pressure, reduce the chances of heart attacks and diabetes. And it just gives you an idea of what you should and shouldn't eat and how much you could eat and how much you shouldn't eat on a daily basis. They're not saying don't completely eliminate things, but there are things that you can do to reduce, to make things healthier. So they want you to increase your antioxidants, because when you're increasing your antioxidants, it's also reducing your as an anti-inflammatory, and that's a natural way. And if we control and have a healthy diet, it reduces our chances of developing any kind of cognitive impairment. Now, there's a lot of natural things out there, and there isn't enough evidence. Coconut oil is absolutely a healthier choice, but you cannot consume enough coconut oil to make a difference, to prevent, to cure, or to treat any kind of cognitive impairment. Ginkgo biloba is also one of those things that you need to be very careful of. Yes, Maha?
Jamie, I just wanted to call attention to the time. We do have to move on to our next presentation, but
Okay.
if you want to just finish up with your last couple of slides, I would really, I would by all means, please do. Yeah.
Okay. So I'm going to let you know that be very cautious about your I just lost my train of thought. Your alternate
My apologies.
choices. That's okay. Your alternate choices. So what I really want to do is, we've talked about all of this, but what I want you to also be aware of is that finding your way. What I really want to do is have everybody understand and really know that there are so many individuals who are living in the community who are living with a dementia. And it is my mission to make sure that people who are living with a dementia in our community can live safely and can live without the stigma. And that if they do go missing, because unfortunately 3 out of 5 people do go missing, I want people to know what to look for when they go missing. Look at how they're dressed. Look at their body language and their behavior. If it seems like they're disoriented, what can you do? Number one, the first thing that you can do is call 911, but be very cautious about what you are going to do next. You don't have to approach the person. And what you can do is stay close by and make sure that the person is safe. Alzheimer Society of York Region has a lot of services that we do offer through all of York Region. And these are some of the services that we do offer. And if you have any questions or you are interested in anything that the Alzheimer Society has to offer, then I would absolutely love to hear from you. Here is all of my contact information. And if you have any questions about any of the information that I've provided today, please give me a call. Oh, I had forgotten to put my email on there, but
you want to give it to me, Jamie?
It.
I can, if you want to just say it out for me right now, actually, I can
Sure,
put it in the chat.
It's J Cruz,
J.
C-R-U-Z, at Alzheimer -York.com.
Awesome.
And if you're looking for any kind of information, or you are looking for any kind of education, or you just want to chat, give me a call, send me an email, and I would be more than happy to speak with you. And I'm sorry that we ran out of time. I tend to just go on and on because I'm so passionate about this and I just love to talk all about it. But I want to thank Maha very much for having me today. And I look forward to having an opportunity to speak with everybody again.
Yes, absolutely. Thank you so much, Jamie, for being here today, for sharing your expertise with us. I know that this is a really fulsome topic that a lot of people have a lot of questions about. So again, unfortunately, because we do want to move on to the next presentations, but because we've run out of time, I'm not going to take any questions at this time, but if you have any questions, please do leave them in the chat and I will make sure that they get to Jamie if you want an answer to that question. And of course, you can also connect with Jamie directly.
And I will email you my presentation and you can distribute it to everybody that has attended today.
Fantastic. Thank you so much once again, Jamie.